All right, I'm so glad to welcome Joseph Kleiman. He's the Chief Financial and Operating Officer at BuzzRx to the podcast. Joe, thanks for being here on an issue that I don't know that a day goes by where Americans don't have a question for us about what's happening with prescription drugs.
Yeah, I would agree with that. It seems it's always an issue. Lately, definitely seems like a hot button.
Yeah, especially with prices. And I want to set the table here for everyone. I want to get into what you guys have discovered at BuzzRx and what you're up to. But first, kind of the overview. Americans spend more on prescription drugs than anyone else in the world. It's true, of course, that we do take a lot of drugs, but what sets us apart is how much the drugs cost in this country. A recent assessment, I found this from 2022, found that drugs in the U.S. are 3 times as high. The price is 3 times as high on average than in about 3 dozen other countries where incomes are high. The annual cost of prescription meds about $1,400 a person, and spending as of 2022 was $634 billion on prescription drugs. But I want to get into the price thing. With all that set up, the simple question is why?
You know what? It's a great question, and I don't think it's as simple as just it's this. You have a lot of players in the space. You have manufacturers, you have wholesalers, you have distributors, you have pharmacies, you have what is now being classified as the middlemen, the prescription benefit managers, and I think everyone contributes.
There was a hearing recently in September, Bernie Sanders among those questioning drug executives, and the pharmacy benefit managers came up. Candidly, I didn't understand how complex and how many parties are involved in the price of drugs. I just know that I go to the doctor, I get a prescription, I go to the pharmacy, I pick up that prescription. But in between, you have the drug companies, the wholesalers, the pharmacies, the insurance companies, the pharmacy benefit managers. Can you give us a sense? Can you explain how all those work together there when it comes to, why I end up spending the amount that I end up spending on a drug?
Sure. We can start at the beginning. You have the manufacturers, whether it's a brand drug or whether it's a generic drug. Then they sell it typically to a distributor, or it could go directly to a PBM, which is a prescription benefit manager. Their function is to negotiate prices, I guess, in simplistic terms, in bulk for health plans. Then you have pharmacies, which obviously the consumer gets their drugs from, and you typically have a contract between the pharmacy and the prescription benefit manager to provide certain formulary drugs. So, and then BuzzRx, we sit in the middle of the PBM and the pharmacy. We negotiate rates for our members. Discounted rates up to 80%, sometimes as high as 90%.
So you guys have kind of gotten into the process here. So the PBMs represents the insurance companies, and you're representing anyone who signs up for BuzzRx. How did we get here? Is America unique in this way in having all these parties? Is it the lack of the government role in setting prices?
I think you can throw capitalism out there, but anytime there's money to be made, you have people that want to stick their hand in. In a lot of other countries where you do have quote unquote socialized medicine, you do have the government that controls it. So there's not as many, at least forward facing moving pieces. In America, like anything else, if someone can make money, even if it's a small amount, they typically will try. And unfortunately, healthcare, specifically prescriptions, that's one of those areas where, BuzzRx has been in this space for 15 years now. And we still are, uncovering different ways that companies, whether it's manufacturers, whether it's PBMs, make money, where we can try and interject our products to help the consumer save money.
One of the subjects of that congressional hearing, and one of the big questions people ask is so who's to blame here? Is it the companies? Is it the wholesalers? Is it the insurance companies? Do you have a sense as to, is it that literally each of those parties needs to make a profit, and so that's ultimately what is driving our record prices here in the U.S.?
I believe so, yes. I think that everybody is trying to make a dollar. Unfortunately, like most businesses, it's not as simple as, we can lose money on certain drugs. You typically have a business model, and sometimes you lose. You got to make it up elsewhere. If you're making more here, you can make less here. And I think that somewhat goes on in healthcare. If it's a health plan, maybe they make a little bit more on primary care visits. And maybe they make a little bit less on prescriptions or vice versa. It's why when you go to if you're an employer and you are getting health insurance for your employees, it always revolves around utilization. It's whether it's your employees and how often they go to the doctor. Do they have pre-existing conditions? For prescriptions, what do they typically take? You always have to answer these questions in detail before you can get a quote back on what it's going to cost you, because it's a balancing act. Like everybody else, I think these companies have margins and they just want to try to ensure that they get there. Unfortunately, a lot of times it comes from prescriptions, but you also have it when it comes to regular go to the doctor type stuff.
So some of the pushback that I heard the hearing was that the extra money that Americans are paying, the extra money these companies are making, helps innovation, helps them create the next generation of drugs.
It does.
And then the argument on the other side was, well, what's the point of the next generation of drugs if people can't afford the current generation of drugs? As you watch this, as you learn about this space, what do you make? What do you make of those arguments?
I think there's some truth to it. I think you got to look at everything in perspective, though. Over 90% of the prescription drugs that are taken in America are generics and are far cheaper than brand drugs. Typically, 80%, 90% cheaper. So a lot of the really, really high prices that Americans they see are on brand drugs. Now, flip side of that is new drug comes to market. I mean, it could be 15, 20 years until that drug is available as a generic or a multi-source brand, which is where you start seeing the price drops.
So talk to me a bit about BuzzRx when you guys came into the market here, and what you found, what you discovered, and how the average consumer, how the average person out there who needs a drug can utilize you guys.
Well, BuzzRx, founded in 2010 by Matt Herfield, our CEO. And I mean, I got to be honest with you. I've been in a lot of different businesses, different forms of consulting. I've done wireless retail, motorcycles. I mean, I did my first business when I was 18 years old. It was a tanning salon. And when I first heard about this, I was like most people, what's the catch? Too good to be true. And it was the same for, Matt Herfield. He learned about this. He was doing point of care dispensing, traveling the country, trying to talk to doctors about dispensing medications in their practice to save money. And in looking at it and in doing our homework, what we realized was we operate very similar to an insurance company in the way that we negotiate basically better prices for our members at the pharmacies. It's free, it's simple, it's easy to use. We offer cards, coupons, a mobile app. You just put in your medication and it'll show you in your area where you'll find the cheapest medication on anything. It's free. You don't have to sign up for anything. And you save up to 80%. BuzzRx is free, simple, easy to use. Just type in your medication. You can go to BuzzRx.com, download the mobile app, type in your medication by strength and quantity, and you can see in your area the cheapest medication. You'll have a bunch of options, save up to 80%. It doesn't cost you anything. You don't have to sign up for anything. It's really simple and easy to use.
To your answer, though, you talked about when you first found out about it, this seems too good to be true. What's the catch? Why?
Well, look at it this way.
Joe, I think the question many people would ask is, how could something like this be free?
Well, it's a great question. And like you said, it's the same question I asked when we first got into this business. But when you dig through everything, we do work exactly like an insurance company. Basically, we go to pharmacies, and if you want BuzzRx members, you have to give them a discount. That is the most simplistic form. And like a lot of large box retailers, we make a very small nominal fee for each prescription that's already built into the negotiated price. And it doesn't cost the member anything.
So since you guys have gotten into the business, what have you learned about the landscape, and how has it changed, especially with the Affordable Care Act and the various trend lines we've been seeing in the industry?
It's crazy. When the Affordable Care Act first came out, I guess, for lack of a better word, there was some concern on what this would do to the space. And the one thing that we realized is people have to take their medication. And with the Affordable Care Act, you had more people going to the doctor. And so our numbers actually increased. I mean, over 10 million people, have used BuzzRx. We save about, $2 million a day for our members. And as much a pie in the sky, you never want anyone to get sick. But if you have to take medication, you want to make sure it's as affordable as possible. I don't see it slowing down, unfortunately. It's people continue to get sick. I think there's a lot of causes for that, everything from people's diet to lifestyle. And I just don't see it going away.
As you monitor the landscape, you have, as you mentioned, millions of use cases. I know you bring in a lot of data. You get a lot of data about the trends when it comes to prescription spending in the U.S. What are you seeing Americans spend the most on right now when you look through your latest data? Yeah.
Funny enough, one of the most commonly prescribed medications is tadalafil, Cialis, when it comes to men.
ED.
Retail.
ED. ED spending, according to your charts, is very big.
Well, it is. It's crazy. And it's funny because a lot of people, even with insurance, they use it. They want to be anonymous, I guess. I still think there's a stigmatism with it when it comes to drugs like that. So that's really high. And we save about 90 to 95% on those at BuzzRx. We see a lot of heart medications, a lot of diabetes medications, chronic use cases where these patients really need to save money, like on lisinopril, which is generic atorvastatin. Drugs like that, we typically save 80% plus. For 90 tablets, I want to say that it averages about $1,200 if you didn't have insurance or BuzzRx. With BuzzRx, it's $25. So there's a lot of really, I guess you could say, essential medications that BuzzRx really helps out with.
Yeah, and the big story of the past couple of years has been the GLP-1s and the explosion of GLP-1s, not just for use with diabetes, but for use with weight loss.
Yeah, that's a funny thing. It's we do offer discounts on that. It is brand medications, so not as deep as you would see on some of the generics. But what's really interesting about whether it's Wegovy or Ozempic is it started out as first it was just diabetic. Then there was weight loss. Now what you're seeing is there's a lot of other benefits that come along with it. And what's going to happen with that, what is decided on how that medication is categorized, really help determine what kind of price is going to be attached to that and how it could be categorized for insurance companies and BuzzRx.
What are some tips you give to your users? I mean, beyond, of course, using your card, ways that they can better save and be more efficient when it comes to their prescription drugs? Is there a tip sheet? What would you say to the average American? And does it change by gender? Does it change by age?
I think the number one thing for anyone out there that takes medication is do your homework. It's take a minute or two. There are options out there. Don't take for granted or just accept that the price is the price. Find cheaper solutions, whether it's BuzzRx.com or another company like ours. Go look, do your homework. I certainly wouldn't recommend rationing medications, even though 1 in 3 Americans are forced to do that. A lot of times when you do that, it leads to worse scenarios. And now instead of just the one medication, now you're on another one. So medication costs are rising with inflation. I want to say, over 3,000 medications between 22 and 23 went up 15% or more. And you have some medications that went up as much as 3,000. It's crazy. So do your homework. If you got to take medication, you got to take it, but just take that extra second. There are ways to help out there.
What's the best way to do your homework? I think one fear that people have are scams. There's so many scammers out there, and you get a promo or you see a website that says we'll save you on your drugs. People immediately get their antennas up, being like, well, there's got to be a potential scam here. So when you say do your homework, where are you doing your homework, and what's the best way if your doctor says you need this drug to do your homework and make sure that you're getting the right drug, but you're getting it at the cheapest possible price?
The easy solution is use the web. Go with, if you're going to use a prescription discount card like BuzzRx, go with one that has a proven track record, has a history, one you know about. It's real easy to find information about prescription discount plans, just like any other business. You certainly don't want to use something you're not familiar with. Your data ends up in someone's hands you don't want it to, which is very, very common. We take that very seriously at BuzzRx, not just with, PHI or protected health information, but even with just regular personal information when you're on our website. That's another problem. A discussion for another day, is personal information and data sharing, but you can learn a lot. And there are some good companies out there like BuzzRx where you can feel confident that it's safe, not just simple, easy to use, and will save you a lot of money.
So we talk as we have an election. I don't know if you've heard in a few weeks there. I know you're in Arizona. You're in one of the 7 states that will determine who will be the next president.
Yep.
Obviously, politics playing a major role here when it comes to, or at least a part of the conversation. I don't know if they'll get anything done when it comes to drug prices, hearings, and the like. When you look at the election, how does BuzzRx approach it, and what do you think, regardless of who wins and who wins Congress, et cetera, that might impact the landscape for prescription meds?
I think that there are a lot of ideas out there, whether you're Republican, whether you're Democrat, or independent. Unfortunately, it's not as simple as this is going to happen. It's got to go to Congress. That's got to pass, then the Senate, before anything happens. I would love to see prescription drug prices, no matter who wins the election, go down. Wherever it lands, we'll still be there to save money on top of even that. I just don't think there's a magic wand where one side is going to do better than the other, whether it's cheaper insulin or overall prescription drug prices. Like we talked about earlier, people are out there, they want to make money, and you got to get a lot of people in line to address the issue. Do you
guys have a perspective on this? And maybe you can say, listen, man, we're a private we're our own company. I'm not touching this. Does the government need to get involved here, like some European countries, and start to mandate some prices? I know when it comes to Medicare, that they have struck a deal with some major manufacturers to lower the price. You tell me if this is tricky terrain here, Joseph, but just curious, there's some countries around the world that have been much more aggressive in setting prices for certain drugs, and certainly here in the U.S., Medicare struck a major deal with drug manufacturers to lower the price of some of the most popular drugs, to the drug manufacturers' chagrin. Where do you guys land on this? I mean, do you see a more robust role for the U.S. government?
It's a tricky question. And I, somewhat from experience, I lived in Montreal, Canada for about 12 years. Started playing hockey there. My father's still there. He was a professor at McGill University. And up there, you have, again, quote unquote, socialized medicine. And typically what I found in programs like that, when you have the government involved, you go down to a single payer solution, for basic stuff, I think it's great. I think if you need anything specialized, or if, for lack of a better word, you want a higher quality of care, that's when it gets tricky. Unfortunately, my father, he had lymphoma, and he had to leave. He came down to the United States to get his treatment because he had to wait in line. There was a shortage on some of the medication that he needed, or it was hard to get. And I think when it comes to the government getting involved, I think for basic stuff, it's almost like if you do that, you're going to have levels of care. and you can have a certain level of care that's great. But if you want something that's really good, then you still have to pay. And they are involved with Medicare, and that's why Medicare is cheaper. You have state-run Medicaid as well. Yes, you have income limits, but it is very helpful for those who do not make. I want to say the national average is just south of $2,000 a month to qualify for that. You have the veterans program in this country that is, again, quote unquote, socialized medicine. But some of the primary complaints about that program is waiting in line for healthcare, waiting in line for treatments. And it's just not, at least at this point, your quality of care isn't there. It should be. But then you get into the other side of the coin again, where you have doctors that want to make money and surgeons that want to make money and hospitals that want to make money. And if they're going to make money, then it starts to cost more. So I don't know if they should be more involved. Do I think there should be something that a hot button right now is price gouging? Who determines what that is? It's tough. We would love to see healthcare, prescription medication affordable for everybody, whether it's Republican, Democrat, Independent. I think they both have ideas. I don't believe that either one of the parties is malicious in the fact that they want people to suffer when it comes to this stuff. It's just a matter of which one of the plans is going to be implemented and work the best.
So when it comes to your plan, what do you guys see in terms of the average savings? For an American, does it differ by state, by region, by age? And obviously it differs by how many prescriptions that you get, but the average user, what can they expect to save on an annual basis?
Average user saves about $850 a month, which is substantial. You have average savings of just north of 60% for every time you use it. And like you said earlier, $1,400 a month on average for someone who's taking prescription medication. I mean, that's 2 car payments. It could be rent in some places. If we're saving you $845, that's half of that. So it's substantial savings.
Before we go here, is there anything else you wanted to add or communicate to everybody?
You know what? It's a problem. And everybody would like to see it get better. If you have to take medication, do your homework. It's not that difficult to save money. And in these times, every penny counts. Go to BuzzRx.com. There's a lot of great information there. Use it if you need it. We're here to help. Joseph, thanks for joining me. I look forward to I look forward to continuing this conversation because it's an issue that isn't going away, though we hope that there is some progress on the horizon. You know what? I hope so, too. I really appreciate you having me, Mo. And again, I'd love to continue the conversation as well.